Myself is Keerthika, Department of Medical Surgical Nursing, E.S College of Nursing, Villupuram. Now I start my presentation topic is endocarditis. So what is mean by endocarditis? Infection of the heart in the inner lining is usually involving in the heart valves. Endocarditis is usually occurs when the germs from elsewhere in the body travel through the blood and attach to damaged area of the heart. Now we move on to the definitions. Infection of the inner lining of the heart, endocardium. It's caused by a direct invasion of bacteria or other organisms is leading to deformity of the valve leaflets. Now we move on to the deposition of vegetarian in valve leaflets. See this image of vegetarian valve leaflet according to endocarditis. Types of endocarditis. According to these types, non-infective endocarditis and infective endocarditis. Non-infective endocarditis is rheumatic endocarditis, varicose endocarditis with SLE, non-bacterial thrombotic endocarditis. In infective endocarditis, acute infective endocarditis, subacute infective endocarditis. The predisposing factors. According to predisposing factors, congenital heart defects. So, congenital heart defect is one of the predisposing factors. Next, a damage the valve by rheumatic fever, atherosclerosis and artificial heart valves. After the cardiac surgery, invasive procedure, dental procedures and catheterizations, IV therapy, minor surgery, gynecological examination, dialysis. Infection of tonsil, teeth, skin, lungs and gut. Immunocompromised patients and IV drug abusers. So those and all comes under predisposing factors. Now we move to the causes. The causes is DRUMS. As a D means a dental procedures and degenerative disease. R means a resistance to antibiotics. U means untreated strep throat infections and rheumatic fever. M means is a major cardiac surgeries. S means is a sticking in the dirty needles and medical use. Next we move on to the pathophysiology. Due to the etiological factors, a bacteria enter into the bloodstream. It may lead to the colonizations and replication of bacteria on valve leaflet. It may lead to the bacteria gets surrounded by fibrin and platelets and form a vegetations and clot travel to other organ forming abscesses. It may lead to damage the heart valves by perforating and deforming valve leaflets. It may lead to, causes infections of organ in heart, kidney, spleen or lungs. It may lead to deposition of vegetation over the valves. Next, we move on to the clinical manifestations. Clinical manifestations according to the F is a fever, low grade intermittent fever, and R is a road spot. A road spot is nothing but is a while center into the retinal hemorrhage is present in the eye. So O is a oscillatory node. It's a painful palpable erythematous or lesion of finger and toes. M is a murmurs. J is a Janway lesions and non-tender lesion of palm soles. A is a anemia and N is a nail hemorrhage and splinter. E is a emboli to major organ. This is the clinical manifestations. And another one is a non-specific manifestation is according to endocarditis, a fever with chills, malaise, weakness, fatigue, anorexia, arthralgia, myalgia, back pain, abdominal discomfort, a weight loss, headache and clubbing of fingers. Next, peripheral manifestations. In peripheral manifestations, peteche, the small pinpoint hemorrhage in the conjunctiva, mucous membrane, neck and ankles. So, in present of the pinpoint hemorrhage in the conjunctival layer. Next, we move on to the peripheral manifestation is road spot. So, boat-shaped retinal hemorrhage near the optic disc seen in your fundoscope, it results from microemboli. To the oscillatory node is red painful node with a white center on the pad of the finger, toes, palms or soles and it a late sign of infections. Next, we move on to the Janeway lesions. A Janeway lesion is a flat and painless. It's a red and bluish red spot on the palm and soles and early sign of endocardial infections. So this is also one of the peripheral manifestations. Splinter hemorrhage. A splinter hemorrhage is the appearance of small dark line under the nails. It will present. So it is one of the peripheral manifestations. According to the clinical manifestations, in clinical manifestations, the first one is a cardiac manifestations. Under the symptoms, a heart murmur with aortic and mitral valve is the most commonly affected. Secondary to embolizations. Embolization is a spleen, sharp at upper quadrant pain and splenomegaly, local tenderness. According to other one is a kidney. To the clinical manifestation about the kidney, it's a flank pain, hematuria, glomerulonephritis. Those symptoms should be present in the kidney. And the brain, there is a present in hemiplegia, ataxia, aphaxia, visual changes and changes in the level of consciousness. Those should be affected for in clinical manifestation. According to diagnostic evaluations, in diagnostic evaluation, STM physical examination, laboratory data, and blood culture sensitivity to identify the organism, best test for detection to sample just before during the height of fever. So whether to check a blood culture is most important for this diagnostic evaluation, and CBC, ESR and WBC also important, ECG and X-ray findings. Next, other investigations is must needed for cardiac catheterizations, 2D echo, valvular vegetations and transesophageal echocardiogram, digital imaging and 3-dimensional transthoracic echocardiogram. And then move on to the DUX criteria, the major criteria and minor criteria. In according to major criteria, there is a two set of blood cultures, a positive serial, endocardial involvement, echocardiography, identification of vegetations, new vascular insufficiency. According to the minor criteria, the predisposing cardiac conditions, a fever, vascular symptoms, immunologic, microbiologic and echocardiogram. Next, we move on to the complication of endocarditis. Congestive heart failure is the most common. It will due to the damage of the aortic and mitral valve. Its embolic episode is ischemia and necrosis of organ, arrhythmias and glomerulonephritis, stroke and brain abscess. This is of the most complications is present in the endocarditis. Next, we move on to the medical management. In medical management, you give a vaccine of penicillin antibiotic and then ceftriaxone, gentamicin. Those antibiotics is must needed for that medical management. Organisms with streptococcus may be treated with penicillin G at 12 to 18 million IV by in 6th equally divided dose for 4 weeks. A ceftriaxone at 2 gram IV for 4 weeks. A gentamicin is a 1 mg per kg every 8 hours for 2 weeks. So organisms with fungal infections treated with antifungal such as amphotericins. And according to the medical management is antibiotics are clindamycin, penicillin, ampicillin, ceftriaxone, amoxicillin, nafcillin, azithromycin, cefazolin, cephalexin and clarithromycin. Those antibiotics all should be prescribed for endocarditis. Next, we move on to the surgical management. Number 1, to do the debriment of vegetations. And another one is a closure of fistula, excision and replacement, a drainage of abscess. Next, a repair of peripheral or cerebral mycotic aneurysm. In surgical management, a surgical repair of valvular deformities and congenital defect. See this picture of aortic valve and fluffy valve leaflet. According to supportive management, a complete bed rest to the patients or repeating culture, nutritional supplements, a close follow-up. A patient with prosthetic valve will require a caution. Anticoagulations is because the anticoagulation therapy does not reduce the risk of embolizations and have the intracerebral hemorrhage risk. Next, we move on to the nursing management. The nurse will monitor the patient temperature and then normal or baseline cardiac function, heart sound will assess a new or worsening. Murmur may indicate a dehiscence of a prosthetic valve, rupture of an abscess or injury to valve leaflet. Maintaining adequate cardiac output and tissue perfusions. Postoperative care and instructions. The nurse will monitor the sign of and symptoms systematic embolizations to assess the sign and symptom of organ damage such as stroke, CVA, meningitis, heart failure, myocardial infections, glomerulonephritis and splenomegaly. So all invasive lines and wounds must be assessed daily for redness and swelling. After the discharge, the monitor and IV antibiotic therapy is delivered to home setting. During the course, antibiotic treatment, performance of ADL, knowledge of therapeutic regimen. Now we conclude my topic. Endocarditis is a serious infection that can lead to significant long-term health issues and have a high mortality rate despite advances in treatment, prompt diagnosis and management by a dedicated team, often involving a combination of antibiotic and surgery, are crucial for improving the patient outcomes. Thank you.